Hello, my name is Marianne Mays, and I am here to introduce you to the panelists for today's discussion, Harnessing Artificial Intelligence Using a Hyper-Automation Platform. We would ask that you submit your questions to our panelists utilizing the attendee menu on the side of your screen. If time restrictions prevent an immediate response, we will share the answers by email to the group. One of the biggest buzzwords in healthcare today is artificial intelligence, and part of the discussion today will describe the highly successful artificial intelligence implementation by First Outcomes at Long Island Select Healthcare. First Outcomes is also a strategic partner of today's webinar sponsor, SmartSource. As a sourcing company, SmartSource works with over 400 U.S. hospitals in providing needed solutions to everyday patient communication challenges. We would like to welcome our first panelist, Dr. James Powell. Dr. Powell is the Chief Executive Officer of Long Island Select Healthcare, otherwise known as Lish. Dr. Powell is a board-certified internist as well as a medical doctor for both DDI and UCP of Suffolk. He oversees Lish's telehealth clinic as well as all clinical operations with over 130 employees delivering medical, dental, behavioral, and habilitative care. Dr. Powell is also a medical director to Developmental Disabilities Institute and United Cerebral Palsy of Suffolk County, and a clinical instructor at Stony Brook University School of Medicine. He is currently on staff at Mather Memorial Hospital, St. Charles Hospital, and Peconic Bay Medical Center. We also are very privileged to have as our second panelist, Dinesh Gambhir. Dinesh is the founder and CEO of First Outcomes. First Outcomes is building the first artificial intelligence, otherwise known as AI, operations platform for healthcare. The genesis to First Outcomes came from Dinesh's consulting work in value-based care, during which numerous administrators expressed their inability to manage the administrative burdens imposed on them by payers in four-letter words. Dinesh is a serial founder, having helped co-found Health Expense and Navatar. He is an alumni of Deloitte Consulting, HP, and Ernst & Young. Dinesh has a PhD in computer science from NYU and was an NSF Presidential Young Investigator. For today's session, David Conley will be our moderator. David Conley is the Director of Healthcare at SmartSource. He is accomplished in B2B enterprise sales to C-level contracts, offering more than 10 years of experience in managing and building client relationships. He possesses an advanced understanding of cloud software solutions, electronic health records, revenue life cycles, business development, contract negotiations, sales presentations, and training. And David, like I said, will be acting as moderator for today's discussion. So with that, David, let's jump right in with our first question.
Dinesh, I was hoping you might be able to help answer what is AI?
That's a good question. AI means many things to many people. In fact, it's become an advertising term. So let's really define what AI is and how it's used. AI, for most of us, refers to something called deep learning. And deep learning is a method of training the computer to recognize things. For example, we can train the computer so it can recognize pictures of parrots. That will automatically tag the pictures. When you do a search, it'll bring up all the pictures related to parrots. That was a big breakthrough that happened in the 90s and what really brought AI to the fore. We're using that ability to train AI to do something as the key to what we can accomplish in healthcare.
Great, great. What are some of the uses of AI in healthcare? You're seeing it more and more today, but what are some of the uses?
There are three primary uses, Dave. The first one, if we keep on the track of images, is actually in radiology, where artificial intelligence is helping the radiologist quickly classify and determine what is being seen. Is it breast cancer, for example? That is a key use. And we extend that to also disease detection in precision medicine. You can look at the actual results of your DNA and determine what's going on. The other thing that's happened is AI has been used to study how people actually work in revenue cycle. They look at the claims that are being processed. They look at rejections and resubmit the claims based upon those rejections. So the AI can be trained to do the same work in revenue cycle, taking over everything which is pretty raw, right? Standard things that are done over and over again, the AI can do. And then the last extension, something which First Outcomes is a pioneer in, is looking at the front and middle offices. Now, AI can actually be used to help people proactively receive care. We can look at everything that is in the population or a health system, and at the same time, we can determine who needs care. The system can automatically reach out to those people and bring them in, that is, set up an appointment with the right provider so they receive care. Our key here is to really take apart the biggest problem that's been in population management, that is too expensive to work with every individual and get them the care they need. So with AI coming in, we do not need to do stratification. We can go with every patient, look at them, and actually get them the care they need proactively so they don't wind up in the hospital or in the emergency room. Jim, anything
Great.
to add to that?
Well, I think one of the things people always ask is why did Long Island Select Healthcare or Lish get involved with artificial intelligence? And for us, and even for me personally, when I go back over my 20-year career, what you notice are the biggest trends are increasing demand of work, decreased amount of time, decreasing efficiency, and increasing friction. So when I look at all this, and I say, well, I can't ask my providers and myself to do any more. We don't have the time to do it if we wanted to, and we really can't afford to hire the staff that would be the ideal ratios to look at ways to kind of maximize outcomes and safety and financial opportunities for us. So that's where this became so exciting for us to look at where we could carry ourselves and prepare for the future.
As a multidisciplinary ambulatory practice, what challenges does Lish have that are uniquely suited for the AI solutions? I know you kind of briefly spoke about them, but can you dive in a little more on that, Dr. Powell?
Sure. So we're fortunate in the sense that we have 21 different specialties, everything from PT, OT, speech, dental, medical, behavioral health, et cetera. A very robust practice, but sometimes I feel like we're puzzle pieces without being put together and working integrated in our workflow. So even though a patient's calling for an appointment, a patient's calling for a follow-up, each department sometimes has uniqueness to it that doesn't allow us to be as efficient and maximize the opportunities for our patient care. So when you look at multi-specialty practices like ourselves, if we can kind of unify the system and get rid of some of the mundane work that our staff are doing now, then we can elevate those other staff members that work with us to do other more quality touch-related activities.
Okay. Well, what was actually done at Lish? Can you explain the solution that First Outcomes put in and how it's working for you today?
So Jim, why don't I start?
Sure.
And please jump in. The first thing we did at Long Island Select Healthcare might seem mundane, but it's very important. When people want access to care, they want it now. They don't want to be waiting on the phone. They want somebody to help them now. And what we saw during our implementation with Long Island Select Healthcare was COVID led to a huge increase in call volume. So the first thing we've done for Long Island Select Healthcare is to actually go in and offload the problem of making appointments, changing appointments. Our software, our platform actually has bots which go out and talk to the patient. And if the patients want to change their appointment, cancel it, our software allows it. And the way the platform is set up, it's not humans interacting with our software. It is basically our bots as a team working hand in hand with Jim's entire front end, with the scheduling, and along with the middle office, the mid-level providers. So the teaming has actually been something very unique that we brought into this idea of using artificial intelligence. Jim actually told me once that with first outcomes in, he could go home at night and not worry that work was left undone, that he was so glad first outcome is looking at every data point every night and making sure the patients that need to be seen are seen without delay. Jim?
Yeah, no,
Maybe you want
yeah. So to the credit first outcomes, we were fortunate to have this relationship prior to the pandemic. So as the pandemic struck, obviously it affected all of us significantly. We were fortunate to have some FCC grant dollars to allow us to buy tablets and technology for individuals to get equipment to individuals, allow them to have video visits when they couldn't come on site. Our big fear was how do we get this information and how do we allow them to log on? How do we make sure that they can be successful in the session? And so with the work of Dinesh and his team, that we were actually able to get to the point where we only have a 1% telephonic rate for all our patients and all our services. So any service that could be done virtually, only 1% of those visits are telephonically. Because when you have a system that allows you to ensure that someone's got the Zoom ID number, ensure they can connect, and if they have issues connecting, can be escalated to a live person, it minimizes some of the work that other providers and other staff members have to do. One of the things initially with the pandemic, which is so troubling for providers, is they would spend 15 minutes of their 30-minute session on the phone with the patient, trying to get them to get to a video visit. And by the time the video visit occurred, they only had a few minutes to actually talk about the issues related to their blood pressure, anxiety, depression. So right off the bat, it was brilliant for us. It allowed us to really see what the value was. And this is only morphed, as we've looked into other opportunities for us in terms of scheduling, looking at patients' metrics, enhancing value to what we're offering.
Okay, perfect. How do you feel that this is really impacting the patient's care and their outcomes?
Well, the big things for us is we talk about, access, engagement, and fiscal responsibility. So how do we increase the access to patients so they don't feel intimidated and or overwhelmed by the opportunity? Do I come on site? Am I off site? What sessions do I need? What appointments are required? Really, being a patient sometimes is a part-time job, and for some people who have significant comorbidities, it's really a full-time job. We talk about diabetics and those with congestive heart failure, et cetera. So if you can make it easier for them to feel comfortable that an AI team member is our team member and not just a voice or a bot sending a message, but it's embraced as part of our workflow, it allows them to feel comfortable knowing that they're going to be able to reach somebody. Things get escalated to a live person. They're never abandoned. And that helps improve their access. That improves their engagement and really makes a big difference in terms of moving the needle to quality metrics.
Great.
Well, Jim, the key thing you brought out and something we've been working with on your team continuously is this idea that the AI is part of the team and to communicate that to the patients, right? In other industry, people are used to picking up the phone, calling their telephone company, their cable company, their bank, and speaking with a bot and getting things done. In healthcare, that's not being done, right? And there are many reasons. Jim, do you want to speak to some of the reasons why healthcare lagged and why you decided to move ahead and allow first outcome to give the same experience to the patient in terms of access, immediate access to care that they have when they want an insurance claim to be done, or their cable channel isn't working and they want a technician to come around and fix the cable?
Well, we could just start with just the telephone system itself. And I'm embarrassed to say that there have been months during the peak of the pandemic where our answer phone rate was about 50%. And this was related to understaffing. We outsourced actually to another country to see if we can get some assistance. Tried that as an opportunity as we tried to leverage what other opportunities there are. So as first outcomes, be able to get into the system, work with us and work with our patients. Our last month we were at 89.8%. So we've gone from a low of 50% during the pandemic to almost 90% and improving upon that. So, which is uncommon for federally qualified health centers because of the amount of phone calls. So there are months we had 13,000 phone calls and we're averaging 1,500 visits a week. So when you look at how many additional phone calls are done per visit, the numbers can get astronomical. So if you can't get through to your health center, you lose trust. If you can't talk to someone when you need it, you lose trust. If you can't get an answer request done quickly, because we're in the now generation, that you have to get a quick like, a quick response, then people become frustrated. So I can schedule an appointment in a fairly easy amount of time. If I can leave a message that gets escalated to a provider and it gets back to me, I've created some opportunities for trust and engagement. So it just starts with the front and it carries through down to the quality metrics, specifically when you're talking about, well, someone's due for a colonoscopy, or perhaps they're coming in for their appointment the next day and we want to do a urine test. So if we can alert the patient, come in, perhaps with a full bladder, or drink some water before you come in, things that we can work toward to guide the satisfaction and the outcomes, then it really becomes a win-win for all.
The thing that I'm most proud of is Jim and Long Island Select Healthcare are actually leading edge. They're part of an ACO. They have multiple value-based contracts, which is unusual throughout the country. And what was nice when we started was it gave us an opportunity to really integrate what the insurance company is saying in terms of performance with what the folks are doing on the ground. We've just started down this path, but we're already showing Jim that we're able to log into any insurance company's portal, take what they're saying about Long Island Select Healthcare's performance, the patients they're identifying as having preventable admissions, and actually actioning that information. We've demonstrated that to Jim last month, and this coming month, we're actually putting that into action where we're getting the data on the ACO, on the value-based metrics on his contracts, bringing it down to his folks, the patient navigator and care coordinators, and actually having them action that is call the patients in immediately. If they're in the hospital, we'll know it. The care coordinators will reach out to the hospital and to the patient. Jim will be ahead of the curve. And I think what's extraordinary is that there are very few other multidisciplinary practices that do this. Large hospital systems have the money to do it, but we're able to bring this to Jim now on a very relatively small cash outlay.
And what's interesting is we changed our view of our ecosystem so that when we look at patients that we're seeing are actively part of our system, so they're registered, they're there. We have what's called our drifters, where they've been part of our system and registered, seen for a visit or two, but perhaps haven't been with us in 12 months, 18 months, et cetera. And then we have our outliers who are actually assigned to us. We're responsible for the care and their value metrics, but we haven't even touched them yet. So if we can have workflows, which First Outcomes helped us with, and looking all three of those patients in our whole ecosystem, and then we can address all the needs for the acute, the chronic, the preventive, and the urgent care that develops, through the course of someone's health journey.
And I want to emphasize, because I've worked with very large hospital systems in the past, and worked after visiting our service in New York, which takes care of many, many patients in the New York area. They're the leading aftercare provider actually in the New York metro area. And what we're able to do with Jim is ahead of the curve for matching just about any other system that I work with. And Jim, I know you have a lot of relationships on Long Island with the large health system that we have here. Would you agree with what I'm stating in terms of where we've taken you in proactive care?
One of the first things Dinesh has said to me is when we started getting to know each other, he says, I can give you pretty diagrams all over your wall and tell you what you're doing, but if you can't act on it and we can't help you move the needle on those diagrams, those pie charts, then what have we accomplished? And a lot of the software systems that we interviewed and looked at was really just about that. Give me a pretty pie chart, give me a metric, but not a solution to move the needle. And if we can't move the needle, then we haven't really accomplished our task.
Yeah, when we started, I used to joke with Jim. I said, Jim, I've met so many physicians who are actually who are truly frustrated, want to pull the hair out of their head because they're told by their bosses that their patient panel is not hitting certain metric targets in diabetic care or in preventable admissions. And they say, what do you want me to do? And nobody really has an answer. And I told Jim, we're going to give you that answer.
We're excited, coming together. It's really amazing.
That's excellent. Well, hey, Dinesh, what makes First Outcomes Solution unique? I know there's a lot of companies out there that are providing AI. What sets First Outcomes apart and makes your solution unique?
That's a good wrap-up question. I love that question. Thank you. So we mentioned some things. So let me go through it. Number one, we're the first solution that says we will action. We're not going to give you information. We will actually make things happen. So our software will actually go out when they see that somebody is due for a diabetic visit and bring them in. And it doesn't matter to us if you have one metric or 6 different diabetic metrics because you have 6 different insurance plans who require 6 different ways of treating the diabetics. Our software is looking at that every night, looking at the metrics you have to accomplish and reaching out to those folks. So we're the first, I would call, actioning solution. As Jim said, they interviewed many vendors, and to select us, I'm really proud that Jim said, yes, you're the guys who will do this for us.
So we mark you as action intelligence as opposed to artificial intelligence.
That's great. Thank you, Jim. That's absolutely great. The other thing is when we action, you'll hear us talk a lot about 2 things. One is teaming, right? We introduce our bots as a team member, a junior team member to the care coordinators, to the schedulers. Because what we're doing is freeing them up from looking at things they don't have the time to look at. They don't have the resources. So we're actually giving them, if you look at it in one way, we're actually giving them a turbo booster for their work. The bots are doing the routine tasks that need to be done, but when there's an exception, when the patient wants to talk to a person, when we see something we can't handle in terms of the bots, it's automatically passed over to one of Jim's team to take care of. And the third thing was when we implemented, we said, Jim, we have to change the perception of the bots with your team, but also with your patients, right? So when the patients come in, they're told that a bot will be reaching out to them. And they're told if you have any problems with this proactive care, you can always talk to a person. So those three things, we action, we integrate the team as part of what we're doing. It's that turbo boost. It's not a replacement. We allow people to do things which they're actually trained to do instead of being on the phone helping people set up appointments.
I think the concept is team-based workflow that we talk about in health centers. And as good as I think I am as a provider, the stats will say that about 30% of my advice is actually retained after appointment. So if I'm seeing someone 4 times a year, how much is really being retained? So if we can get away from that whole funneling approach to healthcare, everything has to go through the provider, which isn't working. It's almost like a spaghetti strainer type of effect where knowledge and information and questions and answers flow through all members of the team and escalate to the right level, then that's really where the value is. So that if AI can reach out a week or so after the appointment to find out, what the response is to a medicine, are they having a side effect on it, how they're feeling, and remind them that they have a test coming up, so that the providers and the nursing staff, the MAs, et cetera, don't have to take on that work, so that when they do have a question, they can spend and dedicate those minutes, dealing with that issue and provide more peace of mind for the patient and the issue that's going on.
Great. Well, you mentioned teaming. What do you mean by teaming approach? Can you kind of dive in a little bit deeper and explain what you mean by that?
Sure. So by teaming, it's really a retraining of the staff to take on higher level tasks and the idea that the machines are doing the mundane work. They can watch the machines on dashboards doing it, but what they're expected to do now daily changes. So as Jim said, our machines are going out and they're checking if somebody, for example, had pain 2 days after a tooth extraction, right? FQHCs are unusual in that they integrate dental care with your preventive care and behavioral health. So after an extraction, for example, or any procedure, they'll check. A person should not be in pain 3 days after an extraction. Normally, that's not the case. But if they are, automatically a person knows that they're going to get a task assigned to them. They'll follow up with the patient, and they can have the time it takes to actually talk to the patient and not under a time limit because the machines are doing that routine work. They're actually able to help the patient. Now, I think Jim can talk to it, but that means for certain people, they have to get more education because they're working at a higher level. Right, Jim?
Which is what they want. We all want to elevate and empower ourselves and empower the people around us. So to have the opportunity to really work at the level of your training is attractive to almost all of us. That's, to me, one of the things that are extremely exciting. We use a term in our office here called quality touch. And quality touch, in our definition, could be an AI alert about an appointment coming in. Now, that's a low-cost opportunity to let a patient know they have an appointment. Whereas if I had the provider calling at their hourly salary to remind the patient they have an appointment, that's really not a valuable quality touch. So if we can make sure the quality touches are set up appropriately for AI, for the MAs, the nurses, all the way to the provider, then we can ensure that we have enhanced engagement and we have enhanced the access. Everything from ordering colonoscopy to getting the results back and setting up referral if there's an abnormality has different people that are involved in that. So if we can have AI and the call center and the MA and the provider all be part of that and working seamlessly in that team-based approach, then the care is a lot easier to accomplish.
Now, I do want to address one thing, Jim. Jim and I have spoken about it, but some of our other clients at First Outcomes, they've come to us because they're not able to hire the people for these administrative functions. The labor market right now is tight. And to get the right sort of person you need at the front desk or in your middle office in care coordination, it's hard to get the right nurses. It's hard to get the right level of front desk person. So having us as part of the FQHC, as part of the medical team, actually allows for the software to take over those functions, and those positions no longer need to be there. So that need for additional people goes away.
Jim? Well, not even hiring them, just retaining them. Our highest turnover is our call center, because most people call, not with good news, with complaints or issues or something they want resolution. So it can be a stressful experience. And one of the things I've done as CEO is I've actually spent time in all the different departments. So one day I spent in the call center just answering and fielding phone calls. And I was amazed at how many calls I was able to answer that didn't really need any knowledge or real expertise, that weren't quote unquote mundane and could be handled by AI. So if I could spend and create more relationships with those and spend a few minutes not worried about having to do 100 plus calls a day to meet up with the demands, then I would anticipate that job satisfaction for those positions will go up as well. And then we talk long-term employment opportunities for us, which is great. And that's the ideal.
Great. Well, it sounds like it really has an impact on the staff. So what happens when AI takes over some of the administrative functions, really impacting the jobs or, at the office level?
So if we think of the future, Jim is going through it, but the future is the care team is very different. Okay, the people you think of as the front end person, we envision now more as the medical assistant greeting the person coming through the door and immediately going in and starting taking their medical history. When that's one thing for face-to-face. In virtual, Jim is already experiencing it. The physician can rely on the bots to actually set up follow-up appointments. The bots can actually interview the patient initially and take vitals. So the care team changes. You do not need that front desk person to check in a person and say, wait in the waiting until your physician is ready. Jim, do you want to elaborate on that?
Yeah, I think there's two schools of thought about the future of AI. One is the concern, is it going to take away people's jobs and reduce that? And when people ask me, well, what happens to my job? I said, your job is going to get better. So our philosophy in this organization is that I have this much work to do and I have this much staff to do it right now. So I have a long, long way to go before I get the value for all the patients that we're trying to serve. So we think this is adding employees to our system, which then creates better value for the organization, for the staff, and then for the patients we serve. So I don't look at this as replacement. I look at this as really additive. And then again, as I was talking about a little bit earlier, if I can make parts of my day better by reducing some of the mundane things that I don't enjoy doing, then my day is going to be better. So the job satisfaction comes up. I think over time, will AI take over a larger role? Yes, but also allow us to have better access to better reimbursement, better access to better quality metrics. So then the employees will going to get the bonuses. They'll do better, they'll feel better, they'll be more empowered. So I think it really ends up being a win-win if looked as a partner and an employee as your system, and not as this is AI, this is my staff. No, we're fully integrated, we're working together. We encourage each as real team members.
Okay. Well, it all really sounds good, but how does this experience really impact the staff and the patients in adopting artificial intelligence?
Well, there's definitely a learning curve. I mean, change management is a big part of any pilot or any change that you do. One of the things that we learned from the pandemic is that we had to change from on-site services to video visits within one day. We were fortunate enough that we were already doing telemedicine prior to the pandemic, so had some experience. So instead of going from 0 to 60, maybe we went from 20 to 60. So it gave us a little bit of an edge. But I think that you have to let people realize that how it's going to help them. one of the flaws, and I still have scars from this from when I went to the EHR years ago, because all it did was give me more work, more aggravation, more clicks, and I was asked to do more. So my job didn't get better as a primary care provider. My job actually got a little bit worse because I spent more time blocking notes, making sure I clicked off stuff, things of value, but it didn't minimize the work. It just maximized the frustration. So when we talk about bringing this into the system, we have to make sure that the providers, the staff, everyone understands that yes, there is a learning curve and you're probably going to do more work in the beginning to understand it. But like the flywheel effect of slowly getting those turns and then those turns multiplying, you'll soon see how the needle's changing, which you're already seeing with our value metrics. You see how the quality improves, and you'll see the satisfaction improve. So we have to just encourage the staff to accept that there's change, and change isn't always easy in the beginning. But if we can make it as seamless for you as possible, we'll do the best we can.
Great. As you adopted AI, has there been any unforeseen benefits that you didn't envision? I know you talked a little bit about the pandemic, but were there any other benefits that AI's impacted?
I tell bad stories and analogies all the time, so forgive me, I'm going to use one now, but there's this famous pizza place by us, and when I go in there, the place is packed, and I see 3 people doing nothing and 8 people running around with chickens without a head. And as Dinesh and First Outcomes came in and they went through our system, I kind of realized we were that pizza place because we never really paid attention to some of the things we do. You just add extra layers when you bring on new services, bring on new pilots. So what it allowed us to do is streamline some of the efforts in terms of what is our workflow, how does our front desk handle stuff, what is our medical assistants doing, how our providers respond to things. So it changed our view of what our healthcare delivery system is. And so you realize, as good as you think you are, there's so much more improvement that can be done, so much more efficiency that can be brought out. So it was an added benefit that I didn't anticipate, but I'm certainly very thankful for.
Okay. What advice would you guys offer for any healthcare organization who might be considering adopting AI in the near future?
I think, Jim, you should speak about the journey, because this is not just a software solution. We don't just put in the software and it works. So, Jim, do you want to talk about the journey?
Well, I'll take a step back by saying that our view of healthcare is a full hybrid model, that we have everything from AI to the brick and mortar structures. That's AI, RPM, chronic care management, video visits, brick and mortar, the whole program. I think that if you're going to consider AI, you have to start by knowing what you're good at now, what you want to improve upon now, and where you want to grow. AI can be a huge advantage to health centers and practices when they're willing and ready to adopt where change is going to take them. I think that when you consider AI, just like what I talked about with the electronic health record, you want a system and you want to consider a system where it molds to you. When we chose our EHR system, we had to mold to the EHR system. It was inflexible, still is inflexible in many ways. And we have to follow the rules that they've dictated. The beauty of the AI and the machine learning is each practice has some unique needs, and some of these things can be modified, although there are standards workflows, but some of the uniqueness of your practice can be brought out and maximized based on what's going on. I think that's one of the beauties I see with First Outcomes, and perhaps not all AIs, but with First Outcomes specifically. So, what are you capable of? Where do you want to go? How it can be morphed into your plans, and can this assist you in the journey and not dictate where the journey goes?
Great. Well, as we're wrapping up, I know some healthcare organizations might want to really understand, the impact that AI has had on Long Island. What kind of implementation timeline did you guys really look at in implementing this and getting this adopted for your patients?
So when we initially go in, we tell the organization that we'll get our technology in place in 8 to 12 weeks. It's really driven by them, how fast they want it. But the go live time really depends on us being able to work with them to get their organization to what we call the teaming level, right? So technology is ready, but once it's ready, we take the time with the organization to make sure they're able to team with the bots. And we tell our clients that we'll be with you at least 1 year as much as you need. That's part of the value we deliver. As Jim said, each practice has some unique things that they want to bring to the fore. If you just ran through the technology and leave, it's never going to happen. So we bring the technology rapidly, but then we work with the organization to make sure their folks are ready for the technology, their patients are ready for it, and that it actually is bringing value, accelerating what they do, making it very visible to the marketplace, giving them great value.
Because you don't want to buy an appliance, you want to buy a partner. And although AI has tremendous opportunities, you want to make sure that partner is really a part of your system. And to Dinesh's point, I think that the more an organization can prepare with their partner, like First Outcomes, to say, how do we maximize our success so when we get out the gate, we're not starting further back than we thought becomes important. So your workflows, your programmatic decisions, all that stuff done beforehand really makes a big difference. Because different practices, I'm sure, will adopt at different rates. One of the beauties of the AI system at First Outcomes, it can go at the rate that the practice can handle, but you want to make sure you have clear deliverables, clear timeline, project management in place to really identify the metrics you want to hit and the deliverables. And if you can have that set up and prepared, then your success rates are going to be much, much, much higher.
Okay, that makes sense. Well, as we're kind of wrapping this up, I mean, it sounds like this is a solution that can kind of be customized based on what you're trying to accomplish and your metrics. Dinesh, is that kind of true? This is kind of a customized type solution for what you're trying to accomplish?
Absolutely. We call it configurable. Basically, we're not talking long implementation time. We set up the software, the bots, for what the practice needs to do. And it proceeds rapidly. It is the change management, as Jim said, the project management, getting the people up to spec, being able to do the teaming, which takes time. And we spend the time to do that. Because if you do that right, you're successful.
Well, great. Well, I don't have a lot of questions, but as we wrap up, I mean, I think we can see the benefits that AI has had on Long Island Select. And, it really has had an impact on staff and what they're able to accomplish after adopting the AI. And as you can see, First Outcomes is able to offer a customized type solution based on what you're trying to reach in your metrics. So, I appreciate you guys joining us today and being able to answer these questions. I know AI is a hot topic in the healthcare market right now today, and I think we can see why it's being adopted at all these organizations because of how it can impact and really change the way your workflow is going. So I really appreciate you guys taking time to talk with me today.
Great, thank you so much. And in closing, what I would just say for us is that, health centers have to prepare, and all practice really have to prepare, going from transactional-based services to value-based propositions. And if you want to be successful in a value-based proposition, I don't see how I don't see how you're going to get there without AI. So if you're serious about value-based opportunities, about value-based propositions, AI will be the foundation of that. So I would strongly consider your practice is considering that as one of the top priorities, in the years to come.
Thanks for adding that, Dr. Powell.
Thank you.
Thank you, Dr. Powell and Dinesh Gambhir, for your insightful presentation. If you would like more information on how your facility can benefit from artificial intelligence systems, please contact David Conley using the contact information on your screen. Thank you also for the questions that were submitted to our panelists. We have exhausted our allocated time. However, all of the attendees will receive our panelists' comments to those questions, as well as a link to the on-demand version of this program. We would also like to invite you to our next SmartSource sponsored webinar on June 23rd, 2021, entitled How Sutter Health and AHMC Solve the Patient Experience Challenge During the Pandemic and Others. Our speakers will include Michael Laidlaw, the former Regional Central Scheduling Director of Sutter Health, with over 35 years of successful revenue cycle management experience. Joining Michael will be Eunice Andea, who comes with the same extensive revenue cycle management experience, but from the for-profit world of the AHMC health system in Southern California. An email invitation will be forwarded to you shortly. Thank you again for your attendance.